Hello everybody, it's John Palafis again. I hope you are all doing well this winter season. Today is February 19, 2015. Today I'm going to cover a whole bunch of facts about Medicare. Medicare is one giant program. When you start throwing out numbers in the hundreds of billions, it starts getting serious. Medicare and Medicaid by themselves are a $800, $900 billion program. But I'm going to discuss is today just the Medicare portion of that whole healthcare spending by the federal government by itself. The Medicare spending in total in 2013, which is the last date that was published by the U.S. government, I have found to be $577 billion. $577 billion, of which $260 billion was Part A, $255 billion was Part B, and there's another $75 billion in Part D, which is drug coverage. Part A is medical expenses at a hospital. Part B are physician visits and small surgeries done in medical facilities outside of hospitals. For the most part, Part A is funded by the FICA tax that everyone pays on their pay stub at 1.45%. That is doubled by an employer also paying the 1.45%. In total, it's 2.9%. If you happen to be self-employed, you get to pay all of that yourself. That is running at a deficit of roughly $25 billion a year. And when we see the media discussing how the non-existent imaginary Healthcare Trust Fund is going to last through the year 2024, they are referring to the Part A Trust Fund, which has roughly $200 billion in it. And that is my calculation for the end of 2013. Taking away 20 to 25 billion for 2014, we're probably at 175 billion or so in this imaginary trust fund. As I discussed last time, there's no Social Security trust fund, and in a similar way, there is no trust fund here for Medicare. It is an amount of money that is a line item in one part of the government. It's immediately lent to the government and spent immediately by the government. They, of course, can print $100 bills all day long to pay that IOU, but that is not my idea of a trust fund. Part B, this physician portion, is $255 billion in cost, and this again is 2013. What people fail to focus on with Part B is the simple fact that over 70% of that is paid for directly out of general revenue, general taxes that go into the government. In 2013, that equaled $186 billion. So essentially, Part A and Part B were funded out of general government revenues to the tune of $210 billion. Part D is drug care costs. Part D is a $70 billion program, and again is paid almost 75% by the federal government through general tax revenue, which costed another $50 billion. So we are looking at a $250 billion deficit, money that comes out of general tax revenue that is not dedicated to the Medicare program from FICA taxes. $250 billion a year. Now here's where it gets a little scary, maybe a little more than scary. We have this baby boom generation. The baby boom generation was from 1946 to 64. And essentially, guys got home from World War II and started making babies. And in 1950, there were about 3.6 million births. And that steadily rose into the late 50s when 4.3 million children were born. And this is on top of annual immigration from foreign countries of about 250,000 people during the 50s. That actually jumped to 320,000 people on average per year for the 1960s. So we essentially have close to 4 million people right now that are entering their Medicare and Social Security ages. And with that, I started taking a look at the mortality rates. Mortality rates in this country are right now, through 2013 again, 2.6 million people passed away in the United States in 2013. Of that 2.6 million, 2 million of them were people over the age of 65. Theoretically, those 2 million people were already on Medicare. If we are adding roughly 4 million people to Medicare annually, but only 2 million are passing away every year, we are adding roughly 2 million people per year to Medicare. Medicare today is a 54 million member organization, 54 million people. Of that, approximately 45 million people are seniors, and another 9 million are disabled, handicapped, injured on the job that can accept their Medicare benefits early, things like that. But the senior citizen number is going to go up roughly 1.7 to 2.0 million people per year from now until at least 2030. That is 15, 16 years. With the average cost of Medicare costing $11,000 a year, we are looking at a roughly $20 billion increase annually to our already huge number of 577 million. And that again was a 2013 number, just using general inflation in medical expense and the addition of another 1.7 million people. I'm guessing when the government puts out 2014 numbers that I cannot find on the internet, maybe they're out already, that number is going to be well north of $600 billion for 2014, which I suspect ended in October. I'm not sure if they're on a calendar or a fiscal year. The point of all of this to me is essentially the government is spending $250 billion a year right now, at least, out of its own general revenue fund. I would guesstimate that we will see by the year 2025 to 2027, somewhere in there, with 5% annual inflation per capita, per person in the Medicare program, we are going to see a $600 billion annual cost for Medicare. That is net of any revenue that they generate that's specifically directed toward the fees and expenses, the 1.45% tax, any add-ons that they include. If you're rich, you actually have to pay for part of your Part B, Part C, and Part D. To put this in perspective, which is really the scary part, we have a $3.2 trillion economy today, and we are spending roughly $260 billion in general revenue from the U.S. government on Medicare expense. That is 7.4%. If you use a 3% growth rate for the United States GDP, that would rise to 4.3 trillion. And using my $600 billion figure, the cost of Medicare rises to 13.95%. Roughly 14% of all monies going into the United States government would be spent on Medicare. You couple this with Social Security and likely interest expense that is much, much higher than today's interest expense on debt that has probably gone up 10 straight years with higher interest rates. And we have a recipe for disaster. I have looked, I have pleaded with people online that I know in the medical community to just give me some idea of where we could fix some of this, and nobody has any answers. I don't know about you. I have a long time to go before I'm on Medicare, and I don't expect to see any of it. Certainly none in the fashion that it's in today. My children, who are still not teenagers, have no hope of seeing any kind of benefits like today's benefits. The unfunded liabilities for this program, meaning the total cost that the government is on the hook to pay over the next 30 to 50 years, I've seen numbers from 10 trillion all the way up to $50 trillion. We obviously have no way to spend, no way to pay $50 trillion worth of medical expenses over the next 50 years. It's impossible. It's statistically not possible unless we have a huge amount of inflation, in which case you would get huge inflation in medical costs. So I think this is one of those elephants in the room that have the possibility of truly changing the dynamics of this country. We still have a bunch of politicians that can't step up to the plate and change any rules, any laws. Who knows, we might even have to change the Constitution. There are tweaks that they can do along the way, but I don't think tweaks are what is needed for today's Medicare. Anyway, I'm going to put a bunch of numbers on the bottom of the screen. I've gone over what I thought I would talk about, but some of these numbers are just tragic to look at. I've spent the last 3 days doing a lot of research on this, and it is just amazing that anyone in their right mind would quote a government media guy and say, oh yeah, the trust fund is going to last through 2024. There is no trust fund. There is no money. Borrowing from one pocket to pay another pocket doesn't work. And, you know, like the name of my mint, 0 Hour Mint, at some point something is going to tip over and you're going to see all the dominoes fall. I don't know when. And we all know that the governments around the world could make a lot of this last a lot longer than we would like to see, because many people want these problems cured, fixed, repaired. But there are a lot of entrenched special interests that don't want anything to change. So until people are forced to change, we have to just continue watching this system get in worse shape. I'll leave it at that. Thanks for your time. I hope you have a great day.